Alright, a normal blood pressure is 120/80. Blood pressure is considered elevated if the systolic or the top number is 120 to 129. Hypertension is considered to be present if the systolic blood pressure is consistently above 130 or the diastolic is consistently above 80. It is very important to control your blood pressure because high blood pressure contributes toward heart attacks, kidney failure, and stroke risk, and it is too late if there are symptoms. Please note this once again. It is typical for people not to have symptoms if the blood pressure is elevated, which is why it is often referred to as a silent killer. So when you check your blood pressure at home, a few things to consider. Check it at rest and not after exercise or caffeine or alcohol consumption, using a reliable blood pressure monitor. Generally speaking, I prefer cuff-based monitors that you can wrap around your arm rather than wrist-based monitors. Many reliable brands are available for less than $50. You don't have to spend a whole lot to get a blood pressure cuff at home. Periodically, it is good to check your monitor readings simultaneously with your blood pressure recorded at your physician's office to make sure it is functioning well. A very important part of lowering your blood pressure is restricting the amount of salt that you use. A good general rule of thumb is to try and lower salt consumption to less than 2 grams of sodium, ideally less than 1.5 grams of sodium in a day. Just so you know what that practically means, 1 teaspoon of salt is about 2 grams of sodium. Lower your sodium by using the following techniques. 1. Read food labels for sodium content. 2nd, avoid or minimize processed foods. 3rd, no added salt, which includes table salt, sea salt, or kosher salt. Just simply don't add it on top of food. 4th, keeping an eye on what the American Heart Association calls the salty 6. Breads and rolls, pizza, sandwiches, cold cuts and cured meats, canned soups, and burritos and tacos. To learn more about sodium, including looking at food labels, please check the link noted above. This is your one drop of knowledge on high blood pressure.